Okay, you don't have to eat a full plate of food to produce milk. You just need a lot of fruits to have enough milk production. So having a thermos of uji, a thermos soup, a thermos of tea, it is very encouraging. But there are levels whereby if the milk is overly produced, you have to slow down on these things. So this shawl, I use it to support my baby to reach my breast level. Remember, hatujabarikiwa the same way. Some of us have very small breasts and others have a larger breast. So for me to reach my level of breast, I have to use a pillow and another shawl or two pillows to support my baby such that I'm not going to lean forward like this when I'm breastfeeding, but I'll be seated comfortably with my
To X living, where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine.
Welcome back to X Living Talk Show. I'm your host, Shiko. Today we are discussing one of the biggest bonds of life, breastfeeding. It's not just food, it's immunity, it's connection to your child. But of course, all this comes with challenges, lots of questions, and lots of myths. With us today, we have Beth Katweri, a midwife at Grace Park Medical Center, who will be taking us through the breastfeeding journey, because I know for moms out there who've gone through it, you know it's not an easy journey, especially when you don't have the know-how of what you're doing. Karibu sana to the show.
Thank you very much for the post. My name is Beth Katweri. As you said, I'm a midwife at Grace Park Medical Center, and I'm glad to serve my clients with passion. Because I know what a mother feels when they are not comfortable, whether they are in labor, post-delivery, the breastfeeding period, all that. Yes.
Of course, now, when a mother has gone through the journey of pregnancy, delivered the baby successfully, we know the next thing is breastfeeding. And we expected to do it automatically. But sometimes it's not just automatically. If you could explain how that goes.
Okay, first I start with defining what is breastfeeding.
Exactly.
And by definition, breastfeeding is feeding a baby directly from the breast milk.
Yes.
From the breast to the baby. It can be direct breastfeeding by the baby, or the baby is being fed by expressed breast milk. So when we say breastfeeding, it's barely the attaching of the baby to the breast and the baby sucking the milk. So it's not an easy journey as people think of. Or once you have a baby, you just place the baby on the breast and the baby is sucking. Not every baby comes knowing how to breastfeed. Not every mother knows how to breastfeed. And it doesn't mean that a mother who has like 3 kids or 4, they know how to breastfeed. No. You can have even 6 children and you still don't know how to breastfeed. It's a journey, it's a class that it needs to be repeated every pregnancy, after every delivery. You should teach a mother how to do these things, because there is part of positioning the baby on how to improve the let down, or how to position yourself as a mother. You cannot narrow it down just to attaching the baby and just leaving the baby there. No, there's a lot of things to watch when you're breastfeeding for you as the mother and even to the baby that you're breastfeeding. There's a lot, in fact a lot that people don't know about
breastfeeding. That's why we are here today. We want to embark on that journey. But before we get there, when a mom maybe is now with child, is there something specific that they are required to do, you know, to prepare for the journey, for this next journey, now the next phase of breastfeeding?
When they are pregnant, okay, every mother, I suppose, every mother who goes to a clinic, there is something called breast examination.
Yes.
When the nurse who is doing the ANC, the antenatal clinics checkups, they normally check your breasts. There are those breasts that have flat nipples, inverted nipples. There is that bit of preparation
Yes.
before you start pulling the nipples. There are those things that you have to start doing, including early retraction of the breast nipples. It assists a lot. When it comes to post-delivery, attaching becomes easy. Also, there are those things that the nurse will start teaching you early enough before you go for delivery, like preparing you for no sleeping after you give birth. You have
Hey,
to
tell
wake
me
up
about that.
and breastfeed.
Yeah.
Because every baby, normally, an infant means like 8 feeds in a day. 8 feeds in a day means
Yeah.
a mother must wake up 8 to 12 times. That is, every 2 to 3 hours, this baby must feed.
Yeah.
Sometimes it is out of demand of the baby, and other times it is by demand by the professionals,
Yeah.
because of the demands of the baby, especially for babies with much weight, the overweight babies who have been born with higher weight, like 3.8, 4
Yeah.
kgs,
Yeah.
4.5 kgs, those babies may demand more compared to babies born with 2 kgs, 2.3 kgs, that way. So for the period on when you time your baby, every 2 hours, you have to wake this baby. If they wake up and they cannot feed maximally, then you know the baby is not yet empty stomach. Remember, their stomach is very, very small, very small. That's why if you calculate the amount of feeds for a baby maybe who is 3 kgs, you find they need around 23 meals of meal every feeding. So 23 is just like maybe 4 spoons of milk. That is the size of
Yeah.
their stomach.
Yeah.
So when you're doing this timing, you have to understand the demands of the baby as well. If the baby is big, they need more time, that is 2 hourly.
Yeah.
If they feel full, they cannot breastfeed as well. So you have to push it to 3 hours. If they wake up before that time, they have to breastfeed.
Yeah.
So you can breastfeed on demand, or on demands of the baby, or according to the let's say a schedule by the way you have been instructed by the doctor.
Yeah, yeah. So there's one question that lingers on most moms or moms to be the question of CS mom and normal delivery. There are those who will say that when you've done CS, the letdown or the production of milk takes time when compared to normal delivery. Is that true?
That's a myth, because milk production or breastfeeding, it is a very complex biological process that involves milk letdown, the supply and demand levels, the hormonal part of it.
Yeah.
So whether you've undergone a CS or a normal delivery, the hormonal bit of it never changes.
Yeah.
The same hormone that makes a mother who delivers normally the uterus to contract, it is the same hormone that is acting to the mother who has undergone CS for her uterus to contract. The same hormone that is causing the milk to be produced for a mother who has undergone normal is the same hormone that is being produced to the mother who has undergone a CS.
Yeah.
So for those are myths, and for one, for milk to be produced, it can be out of there is the letdown bit of it.
Yes.
Letdown comes in this way. You attach your baby to the breast. There is stimulation from the breast to your brain. So the brain will trickle down the hormone that is called prolactin that will cause the milk to come down. With the help of oxytocin, which causes the contraction of the uterus and the breast muscles. So at the same time, this hormone is acting on the uterus of the mother. So it has two effects, to the breast and to the uterus. So the healing is taking place as well as the breastfeeding is taking effect. So this one also acts the same way to the mothers who have undergone SES. So at the end of the day, the hormonal effect of it all, it is taking effect, and the milk will automatically come. There is the supply and the demand. The more the baby is breastfeeding, the more the supply. It's like if I give you two jars, one is empty, the other one is filled. You start filling the empty jar. What happens? It will come full and you can't add more. But the empty one, the one that you've emptied, you can add more. The same way, if you empty breast frequently, so the milk will still flow in because there is a space. Again, there is a bit of other factors that will cause the milk to come, including positions. Like there are many other things that can hinder or can promote good breastfeeding.
So now there are those, like you've said, like those moms who will come in, you know, we find that mothers even shame each other because you will find one mom saying mimi sina maziwa. Unaona? And then there's another one saying yangu ilikuwa mingi sana. So you find there's that shame and the mom feeling as if there's something that they are doing wrong. What makes these differences that you can find even in a hospital setup? Two moms have delivered here. One automatically has milk, the other one doesn't. That it gets to a point where you have to give medication or stuff like that to stimulate the breast milk production.
So actually, it is not wrong to support lactation. It is the best. Why? Because we want breast milk for the baby and avoid the formulas where necessary. So when we have these mothers who have a lot of milk, you even emphasize, please encourage your friend, even for them, it will, no matter the time it will take, but actually, with the time, you're going to have your own milk. So you have to, you just chip in a friendly way, like no one will take it in a bad notion, but there's that part that you encourage them, please talk to your neighbor, asisikie vibaya that ana maziwa. Hata wewe kuna wakati haukuwa nayo. And for this mother who has no milk, you have to support this mother fully because this is where stress comes from. A baby who is not breastfeeding and there is milk, or a baby who is not breastfeeding, there is no milk, or a baby who is not breastfeeding and there is no milk. Those are three categories. All that is a stressing factor to a mother because no mother wants to have hard time when nursing their babies. No mother wants to have supplementation of those formulas now and then because one, it is costly, it is time consuming, it needs techniques. Handling that milk is another task. So you have to encourage these mothers who have no milk that we are going to walk this journey together. Show them the positive side of it, that you see even the baby is suckling, the milk will come. Do not watch so much on the formula, but keep attaching the baby to promote the stimulation of breast milk production. With that, they turn out very positive and they cooperate. Very, very much cooperating.
Yeah. Yeah.
They just need advice, comfort, assurance, and that's all.
Yeah.
Yeah.
But does it get to a point where you say now, this mother, it just won't happen and we're just going to do our formulas? She's very healthy, nothing is wrong with her, the nipple is fine, but just gotten to a point that it's just not happening.
It's very rare to have a mother who has no milk. The milk can be there, but the letdown may be either the supply is low
Yeah.
or the letdown is low. But that doesn't mean she doesn't have milk. Maybe the demands of the baby are higher than the supply.
Yeah.
So for this mother, you need to support them with formulas. And formula si mbaya, but it is not the best for a baby.
Yeah.
That's why we say use them where necessary, and when you can avoid, avoid them. You know the repercussions, the costs, the handling of the milk and all that. So for these mothers who can surely not satisfy their babies, and it has been noted that for sure this baby is not getting full stomach, no matter how long the baby stays on the breast. But before you decide on that, topping up every feed, you have to do assessment to the baby. Ensure that you have checked her mouth, the baby's mouth, whether they are okay, because there are other conditions like tongue tie, whereby the skin between the tongue and the base of the mouth, it is too short or too tight, so the baby cannot breastfeed adequately.
Yeah.
So if the baby is not breastfeeding adequately, the letdown will be poor, because the baby cannot empty the breast so well to allow more milk. So with that, the supply will go low. So if there are not those conditions whereby they are limiting the baby from breastfeeding well, thus hindering the production of this milk to sufficiency levels, then you have to top up this baby. You have to assess the baby, assess the mother, know where the challenges are. Because if the milk is not okay, if the milk is not enough, there are many factors to figure out, including, did we have all the placenta parts and membranes expelled? Because if they are retained, the uterus cannot contract adequately. So the oxytocin that is being produced is minimal. The contraction is poor. So the letdown will be poor as well. So there are many things you have to go down, down before. And as much as you're telling this mother to supplement the baby, you have to encourage them to boost their nutrition, maybe the amount of fluids they are taking per day, because if they put their effort too much on the supplementation, they forget about their effort on So they have to do add in add. So you teach them the advantages and the disadvantages. So that now they can adhere to which is the best route to follow. As much as najua kuna mtu utaambia supplement the baby, mtoto akiamka hivi tu korogea nani. That is, it happens actually even in the wards. Korogea mtoto nani. Wengine wanafika home, you have your nannies there, you have your aunties who are taking care of you after delivery. So you're there instructing. Alinyonya saa ile ingine mkoroge nani. Eventually you find you're not doing what you were told. You attach the baby first, then you supplement when they are not full. Because not every time hawatashiba. Watashiba. Ni vile sasa sio kila saa. So you have to supplement. Supplementing is not wrong, but doing it the right way.
So you've mentioned something about nutrition, and of course nutrition and supply. Let's bust another myth. We, especially sisi wa Afrika, wa Kenya, wa Meru. You've had a child. Shosho pale, mother-in-law pale, jug kaa mbili, thermos kaa mbili za uji. A whole dish of mukimo is here waiting for you, njai. Hey, in a day, yani you look at one table that is just for one person and you're wondering, huyu ni mtu mmoja atakula hizi zote. So give us a little bit about nutrition. Do we need all these things, and how much do we need really?
Actually, you don't need all that. You just need to take the necessary.
Yeah.
And the necessary means, okay, you don't have to eat a full plate of food to produce milk. You just need a lot of fruits to have enough milk production.
Yeah.
So having a thermos of uji, a thermos soup, a thermos of tea, it is very encouraging. But there are levels whereby if the milk is overly produced, you have to slow down on these things.
Yeah.
Especially the first days of the first week, from day 3 to around day 10 after delivery. There are times you step down slowly from those drinks, too much drinks. Why? You overproduce milk and the baby cannot consume all this milk.
Yes.
So you get breast engorgement. If you're not taking care of the breast well, you find yourself having mastitis and all that. Or too much pain that even the baby cannot attach that breast because of engorgement. So taking fluids is 100% right. But there are times when you have to slow down on consumption. Eating full plates of food is not essentially the source of breast milk. Not really. But you have to feed on something to fill your stomach. And for that case, you have to major on light diet for the first few days. Especially for patients who have undergone surgeries, whether it is CS, there are those who have undergone extension down there for episiotomy, the tears, they have been repaired. Because the more you eat a bulky meal, you're going to strain when you go to the loo. What are you causing to those muscles? The healing will be a bit rough. You have a lot of discomfort, especially for those who doesn't take teachings on self-care after delivery. They may have it too hard. And these stresses, they are the ones that now we trickle down to low milk production. A lot is connected to breast and breastfeeding. So every mother who is breastfeeding, who has delivered, they should major on drinks, food, little portions. But there is that there is that emptiness a mother feels on their stomach after they have delivered, because the pressure that was pushing it hard has gone. So you feel like there's a kishimo kwa tumbo, and you feel like it should be filled, and it is okay. But now use the uji, hizo vitu kukunywa. You spare yourself when you go for long call. And milk doesn't come with food. Hizo food, we can do with fluids and be okay.
There's something you've mentioned about, feeling as if you literally have a hole in your tummy. Tunasikianga our husbands, and husbands and men out there, when they are sitting down, they've had their wives deliver, and they're like, we anakula ni kama fundi wa mjengo. Kumshibisha imekuwa. So it's literally, now I hope you get it and you stop judging your wives. It's literally that's how she feels, as if she has a hole that she has to fill.
Remember when the baby was intra-abdomen, there was that pressure pushing the stomach up. So that's why a pregnant mother will take frequent meals, but tudogo. Hawezi kula mingi. Akikula mingi anashiba, but ama anaanza kupata hiyo reflux and all that. But they take small bits, anatulia. So once the baby is out, there is now a relief from that pressure. So there is more space for your stomach. So you can feed more. You can feed more than you're feeding.
Yeah.
Remember, we are feeding for 2. So the demand is higher than before.
Yeah.
Like I'm feeding and this food is rushing to milk production.
Yeah.
I'm taking, it is rushing to milk production.
Yeah.
So it is true.
So at least we've also bust
wasijudge.
another myth of when a mom tells you that she's feeding for 2, it's literally true.
Yeah.
Muache kujudge wa mama huko nje. So we are going to take a short break. When we come back, of course, Beth spoke about latching. What is that? You know, you spoke about there is a correct way of breastfeeding, of attaching the baby. She has a baby here on set. She's going to show us that. You don't want to miss out.
To Peaks Living, where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and chat.
Healing hands are strong in the heart of Middletown. Grace Park lights the way, bringing hope to every frown.
Hello, my name is Maureen. At Grace Park, we believe in transparency and communication. As a patient, you have the right to receive respectful and compassionate care, to be informed about your diagnosis and treatment options, and to have your privacy and personal health information protected. We understand that your experience matters. We guide our patients through every step of their healthcare journey, including coordinating appointments, providing emotional support, and ensuring you understand the treatment options. At Grace Park, we go over and beyond to prioritize these rights, to ensure our patients feel safe and valued.
Grace Park's legacy, guiding every flight. Grace Park Hospital echoes through the hall. Grace Park Hospital, answering.
Hello, I'm Jelinda. At Grace Park, patient trust is the cornerstone of our practice. We are dedicated not only meeting their expectations, but also exceeding the standards of the care and privacy. We go over and behold to create safe and supportive environments where patients can focus with their wellness journey.
We value your feedback. It is invaluable in helping us understand what we are doing well and where we should improve to meet your high standards of care. Talk to us via our customer support line that is available to you 24/7 on 0111 053 800 or through our social media platforms.
To Peaks Living, where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and chat.
Welcome back. If you just join us, we are discussing breastfeeding, which is actually a very broad topic. But one of the biggest mistakes that moms make is how you latch the baby, or rather, how do you feed the baby? It's not just about just picking the baby and putting the baby on your boob. So Beth will be showing us practically with her baby. She's going to tell us the name of the baby. I hope you've named her. Is it a she or a he?
Oh, my baby is baby T.
Baby T.
Yes, baby T.
Uh-huh.
she's a very pretty girl, in quotes. I don't have a girl, so
By the end of the show, probably you get to meet BBT.
please, okay.
Anyway, so
So we have this concern about how mothers are breastfeeding their babies.
yeah.
One, you start with preparation. Before you breastfeed a baby, you just don't come from outside and you just take a baby and put the baby on your breast. You add wash your hands. That is one for hygiene. Then ensure the environment is safe for you and the baby. You cannot just sit under a roof that is falling, or maybe there are harmful things that can be thrown
hit the
onto
baby.
you. So the environment that must be safe. Then the seat that you're going to use, or a couch, should be a comfortable one. Should not be broken, that you need to balance yourself in a way to be comfortable. No, you should sit and let your body flow, like you relax. So when I have my BBT here, I'm seated with my BBT. My seat is comfortable. As you can see, my back is leaning straight. If you use those Ken Poly seat, you can have a pillow or a comforter pillow at your back, such that you don't have to lean, straining, or forward to reach the baby. Your feet should be not hanging. They should be stepping down, either on a stepper or on a firm ground, such that you can support your baby well without having to lift one leg, the other one is slanted or something like that. Then you have to have a support pillow or a nursing pillow. If you don't have a nursing pillow, you can have even these shawls, the big shawls. You can fold them enough to place under your arms. These shawls are not for holding the baby. You see, I'm holding my baby with a shawl. That is wrong. When I'm intending to breastfeed, I have to put this down. I be left with my baby tea. So this shawl, I use it to support my baby to reach my breast level. Remember, hatujabarikiwa the same way. Some of us have very small breasts, and others have a larger breast. So for me to reach my level of breast, I have to use a pillow and another shawl or two pillows to support my baby, such that I'm not going to lean forward like this when I'm breastfeeding, but I'll be seated comfortably with my pillow and my baby attached to the breast. So before you attach your baby, there should be very minimal clothes between you and the baby. That's why I'm going to take off these as well, and I'll have it with my baby tea.
There goes BBT.
There's baby tea, and my baby tea is here. So my baby tea is not going to be breastfeeding facing upward. No, I have to prepare baby tea. First, I have to prepare my breast. You've cleaned your breast, you've exposed it. So now you're here with your baby
What
tea.
am I using? Can I use wipes?
It is recommended to use warm water because wipes are not sufficient enough unless hujatoka mbali kwa dust nini hivyo, you can use, but kama umekuwa within the house you can still use the wipes, but si zile ziko na alcohol, hizi zingine na si zenye ziko scented, because that one can hinder the baby from breastfeeding well because of those scents. There are babies who are very sensitive to perfumes. So my baby tea, I'm going to hold my baby tea. So before I put her to the breast, I have to ensure she's well aligned. That is, her body, her trunk should face my stomach. So this hand that is on my side should come towards my armpit, below. Then I will align her to my stomach like this. Remember, baby T is lying on the elbow, and my hand is supporting to the buttocks level. You see? So I'm not holding my baby like this. No, I'm holding my baby entirely, the whole body. So the baby is fully supported. Our head should face the breast, such that my nipple should touch the nose of the baby T.
Yeah.
Why touch the nose of the baby T? So that the baby opens the mouth wide to allow the nipple to go in without really grabbing the nipple with a very shallowly open mouth. So I'm going to hold my breast, my baby like this, with the body facing me. That is the here, the shoulder, and the hip should be in one line. This here and here, they should be in one line, not tilted like this. No. Or the other way round, whereby you find a baby is breastfeeding facing upward and the head is tilted. That one will hinder the duration of the baby breastfeeding due to discomfort. Even swallowing becomes a challenge because of the twisted neck. Yeah. So when I hold my baby like this, I'm expected to attach the breast by supporting the breast. Just do not let the baby just suck. No. Again, there's another mistake mothers do, stroking the breast.
Makasi.
Tunakata. We are here doing like this. Ndio mtoto ashike. If there is a challenge in latching or attaching the baby, you don't have to stroke the milk, the breasts. You just need to hold it like this, and you hold it to the baby. Not like this. Once the baby has settled on the breast, avoid doing this. You hinder milk flow because milk is stored in ducts. So these ducts will let down the milk to the nipple, or the ducts that release the milk to the baby. Once you stroke, you block. Especially the tight. Unapata mtu amefinya mpaka ina. That is not good. So my baby is very comfortable, and you can easily tell a baby who is well positioned. They are comfortable, they are not fussy, they are not irritable, and the baby can attach to the breast very well. Those who have bigger breasts, you don't have to have so many pillows. You just need one to support your arm, because you can't keep lifting this baby like this. You need to rest it somewhere without leaning. Remember, we are taking care of the mother's back and comfort. Any pain can trigger stress. Stress will cause milk to go down. So we have to ensure all areas are well covered and protected. So my baby is comfortable. And as a breastfeeding mother, how should I know my baby is attached well? There are those signs of good attachment. One, the lips of the baby. They are normally like, it has to look like this. Out. They are out. With the lip, the upper lip, covering a smaller region of the black part of the breast, but the lower lip covering a larger part of the lower part of the black part of the breast, or the areola. Then you can easily tell a baby who is breastfeeding well. He will suck and pause to swallow. You suck and supposed to swallow. Just like you can use a straw. You can't use a straw continuously. You have to pause. The same way happens. So they suck. You see changes on the cheeks, the fullness. They suck, you see some change on the cheeks, and they will swallow. Once that is done, when the baby now empties the breast, they normally feel like, I'm not getting enough, so wanaanza kutoka kwa nyonyo nini. And those that are very sleepy, akalala tu juu anaboeka. So it is the work of the mother to ensure once the one breast has gone 15 minutes, change to the other breast. Go for 15 minutes to 20 minutes. Why that? My baby T will take 5 minutes to breastfeed on one breast and will pick water.
Yes.
That is, breast milk has two components. The fore milk and the hid milk.
Yes.
So the fore milk is more of water and it serves the purpose of quenching the thirst. You see?
Okay.
So a baby who is very thirsty,
Yeah.
who is irritable because they are thirsty, they will just quench the thirst and they will get out of the breast. They don't need to be full. They just need to quench the thirst.
thirst.
A baby who is empty stomach, who is hungry, will quench the thirst and still continue breastfeeding because they need to fill their belly. So the problem we have with mothers, who breastfeed 5 minutes, they rush to the other meal, or the baby sleeps, and the next time they will take the baby to the next breast. So eventually, the baby will be taking more water than nutrients. The fore milk is more of water, and the hid milk has a lot of nutrients, the proteins and fats, which helps the baby to gain immunity and gain weight. So if you find a baby who is not gaining weight and the mother has enough milk, then you have to watch out on those latching and breastfeeding patterns because they hinder a lot. So if you find a baby who is gaining weight slowly compared to the weight they were born with, of course, there is a weight that is expecting for every child from birth weight and the gestation which they were born at. Because a baby who is born prematurely with very low birth weight, you don't expect they will peak with the same rate as a baby born at term with the good or the normal weight that is expected. So my baby T will breastfeed for 15 to 20 minutes until I feel my breast is empty. If this breast is out, emptied, I'll just switch to the other breast and I breastfeed for 15 minutes. Now, there is that question you asked about formula. I've breastfed this baby for 1 hour, 2 hours. Ashibi. And the baby is irritable. Akona hizo signs kabisa hajashiba. And I can squeeze my breast ziko na maziwa. Either ni kidogo ama hiko. But now, kama hiko, why is this baby not getting satisfied? That's why now you go to assessment of the baby. Again, if the milk is not enough, what is the problem? Could it have been all along from the attachment, positioning, all those things? Could there be stresses that are triggering this baby, this mother not to have enough milk? Because at the end of the day, breastfeeding is affected by many, many things. So my baby T will breastfeed for those minutes, and I'm sure with 40 minutes per every feed, my baby will have all the nutrients that they need, especially for the first days of life, whereby we have a milk content that is called colostrum. Actually, I don't like when mothers express and throw it away. If you have a way of storing it, you better have storage bags, express and store it. Then you can have it given to your baby because that milk is very nutritious, very. But as days goes by, the milk goes changing. Unaanza kusikia kuna mature milk hivyo. Mature milk now ni ile imechange, imeanza kuwa white, all that. So my baby is attached properly. The lips are well positioned, the suckling is okay, but I should not hear a baby who has sounds like Ama?
But you're thinking they make that sound because it's too delicious.
No. No. That means that baby has not attached well to the breast. The latching is not okay. Thus, there is a space between the nipple and the upper part of the mouth. such that it is not pressing on well because the nipple has not gotten inside the mouth completely. So the tongue cannot press on the nipple. So you have to feel that cracking, that clicking sound. Because whatever is supposed to be there is not there. Matiti haijafika mahali inafaa. So akivuta movement ya tongue inaguza pale juu, so atatoa hiyo sauti. So that is one common thing unapatanga kwa watoto wenye hawajashika nyonyo vizuri. Now I'm not yet finished with my baby with breastfeeding. Before I check on whether the baby is breastfeeding, kuna part wa mama usema nyonyo itafunika mtoto. Honestly, for a person who has very small nyonyo, that nyonyo cannot ziba mtoto pua. Wacha tukue honest. But for those who have big busts, it is possible. But now, how do you do that? Tumesema hakuna kufanya makasi. Once the baby is attached to the breast, you can still maintain the position of having the breast held like this, or you hold with a finger above the nose of the baby. Secondly, those who have big busts, avoid breastfeeding your babies when you're lying. Why? You may fall asleep and the baby may cover the nose. Unlike when you wako na nyonyo. Because now you may, unajua mama mwenye ananyonyesha, they get very tired, they get exhausted, they can sleep anytime. So you may think you're breastfeeding and the baby chokes or suffocates from the covering of the breast. So before you decide on which position to hold your baby or to breastfeed your baby, make sure you understand these dynamics because some are very dangerous for some categories. So my baby will complete breastfeeding in this position, and after I'm done with breastfeeding, I'll hold my baby up here. Why am I putting my baby up here? I want her to burp. Why is this baby burping? Kuna mama ataniambia, nimeshinda nimemweka hapa 40 minutes na atoi hiyo gas. Not every baby who will give out that sound, the burping sound. No, not every baby. That sound or that burping is as a result of the gases or the hair the baby has taken in when we are breastfeeding. So when you burp the baby, you're weeding up that gas. So ukiona mtoto atoi hakumeza gas yoyote, you just let them lie down. Unamlalisha. How do you position your baby when they are going to sleep? Na watu wanasema you put your baby lying on a side.
It's very controversial, by the way. How to place the baby while they are sleeping, it's very controversial.
So how am I going to place my baby when I want them to lie? It is advised to lie them with the head facing up, not side. There's something called sudden infant death syndrome, SIDS. It is less common with babies who are laid down like this than babies who are kept like this. They say when you lie the baby on your side, once they burp or they take out the milk, they can easily roll down to this position. And this is dangerous. Unlike when they are up like this. So people will say, akilala hivi, ikitoka itamchoka. Ati akilala na side ndio itatoka. It is even more dangerous on side.
So alale akiwa
alale na juu. But you find to everyone is putting the baby
na
like
mpaka
this.
Una support hapo nyuma.
Hapa unaweka kitu hapa.
Vile hata tan.
Asigeuke akuja hapa. Those are okay. As time, there are things that you may not discover them on one day, but as time goes, you just identify Juu utapata mama anakuza nitawekelea mtoto aje. You know, you find 2-3 people asking you the same question. You have to go dig deeper.
Yeah.
Why is this question so common?
Yeah.
And how should we advise them?
Yes.
So when you go deeper, you understand, so even this side position is not the right one.
Yeah.
Because we keep na unamwekea kakitu
Sindio, hata pillow tuna.
Yes, ndio. In case. But remember, his baby will remove that milk, you feel agitated and you roll on their stomach.
Yeah, yeah.
What happens next? Another
I don't wanna imagine that.
Yes.
Now, director pale anataka kuleta shida sana. I know there's a lot about breastfeeding, and that's why we are definitely having a part 2 of this.
Yeah.
But there's one important question that I have to ask. Yes, we've explained about latching, which of course, when you latch well, when you position the baby well, that means that even as a mom, munaona mazoea, she's so used to holding a baby and how to cover the baby well, she's definitely going ahead to do it on a doll. Teddy bear.
Kuzoea.
But anyway, so if you do it well, that's how you also avoid the breast cracking, because I know that's one of the biggest challenges that moms are having. That's why even some moms will just generally just even hate breastfeeding and go ahead and use the formulas. So tuweke tick kwa when you latch well, no guarantee, no cracking.
No cracking.
Yes.
Kabisa. Though there are those who have sensitive nipples all the way from pregnancy, because of the hormonal effect during pregnancy, the hormones that prepare breasts during pregnancy to produce milk, that is estrogen, progesterone, they are very present during pregnancy. So they may end up softening the breasts, the nipples, to be very sensitive, such that a baby who is attaching well, because of that sucking and all that, they may have some sensitivity on the breast. But every mother will feel that for the first days of breastfeeding because of that change. But as time goes on, they keep adopting to it. The immediate latching will feel that discomfort. But afterwards, after a few minutes of latching, it is okay. But you find the pain is persistent, even after a few minutes, the latching is not okay. Thus, you continue worsening the condition. That is whereby we have cracked nipples. And cracked nipples are very painful. Those who have had it, they can attest to that. You feel like a very sharp cut. Sometimes, remember, there are those who have after pains, whereby after the baby has attached the breast, there is that contraction to the uterus. So you have two pains. You feel the discomfort on the breast and the pain on the uterus. So that one makes even mothers feel like, I don't feel like I want to breastfeed this baby again. It happens. So those cracked nipples or bleeding nipples, there are those who have even something called rusty ducts or bloody ducts, whereby the milk that is being produced, the first milk, it has rusty stains, like it has blood content. It is normal. It is very okay. You can express the milk if they're not comfortable with breastfeeding, or you just breastfeed the baby. It has no harm. Kabisa. It has no harm.
What can they do to relieve the cracks for those who already have them?
You can use your breast milk. You can use their creams that are used for that. Nipple creams, lanolin creams, lanolin nipple cream, not the facial one. They are different. So if you go to chemist, you can buy over the counter. You can use your breast. Your breast milk. You can use the Vaseline jelly. You apply to ensure it is soft, to avoid it being hard. If it is hard, the time the baby comes to attach again, comes another challenge.
It's a whole new wound.
Breast milk is easy. It's a lot.
Beth, where part 2? I know there's so much that we've not tackled. That's why I would also encourage you to post post the questions even on our social media pages. What would you love us to discuss next? We can add on to the questions that we haven't even been able to tackle today. Beth, thank you so much for joining us and of course sharing and impacting women and mothers out there. Of course, what you've shared with us today is not only medical, but of course you've also encouraged moms, because breastfeeding is not as easy as people think it ought to be. Before we go, let's bust one more myth. Cabbage leaves on engorged nipples or painful boobs. Nara.
Those are myths.
Hey.
Engorged breast, you have to relieve with expressing the breast. You have to take off the milk.
Yes.
No matter how much ice cubes you place on those breasts, as long as they are full, you have to empty them.
Yeah.
Only if it is not contraindicated. For example, for those who have lost their babies, they are not encouraged to express because it will promote more production. But there are drugs that can help in making the milk go down. But or the baby is sick, cannot breastfeed.
Yes.
Due to other limitations. But for normal express the milk, please discard it. Use of leaves, cabbage leaves, no.
Keep on sending those myths. We are going to bust them on the next episode. That is the part 2 of breastfeeding. Beth, asante sana. Barikiwa sana. Keep on doing the good work that you keep doing. Already tuko na prove hapa that you're doing a good job. Kama huyo ni teddy bear umeshika hivyo hadi saa hii. Hey, baby T. Okay. Hope to see you on the next episode. Thank you so much, guys, for watching. And just a little message for any mom there. Dear mother, your milk, every drop of your milk, it's a sacrifice, and a sacrifice that is totally worth it. It's an immunity for your child. Those sleepless nights, they are all going to pay with a child that has proper immune, with a child that has proper weight, and with a child that is worth everything that you've gone through. Keep on doing the good job that you're doing. Believe me, you're enough. Even in the world where there are standards even for new moms, you're enough and you're doing a good job. Let's continue subscribing, liking, and sharing. Until the next episode, bye-bye.
Two weeks living where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow, that's what we're all about. Come on, join our family, let's really shine. Games and chat.
Healing hands are strong in the heart of Middletown. Grace Park lights the way, bringing hope to every frown.
Hello, my name is Maureen. At Grace Park, we believe in transparency and communication. As a patient, you have the right to receive respectful and compassionate care, to be informed about your diagnosis and treatment options, and to have your privacy and personal health information protected. We understand that your experience matters. We guide our patients through every step of their healthcare journey, including coordinating appointments, providing emotional support, and ensuring you understand the treatment options. At Grace Park, we go over and beyond to prioritize these rights, to ensure our patients feel safe and valued.
Grace Park's legacy, guiding every flight. Grace Park Hospital echoes through the hall. Grace Park Hospital, answering.
Hello, I'm Jelinda. At Grace Park, patient trust is the cornerstone of our practice. We are dedicated not only meeting the expectations, but also exceeding the standards of the care and privacy.
we go over Red Behold to create safe and supportive environments where patients can focus with their wellness journey.
We value your feedback. It is invaluable in helping us understand what we are doing well and where we should improve to meet your high standards of care. Talk to us via our customer support line that is available to you 24/7 on 0111 053 or through our social media platforms.
To Peaks Living, where we shine so bright. She goes the host, making everything feel just right. Love, laughter, and glow.